heard this term monkeypox recently many times. What is this monkeypox virus? How monkeypox virus affects human body? How can I prevent ourselves from this virus? How to give treatment if anyone gets sick? We will know all these answers in this video, so don't skip the video. Hey guys, myself Sukant, welcome back to my channel. Monkeypox is a rare disease caused by the monkeypox virus, a member of the orthopox virus genus in the family Poxviridae. Monkeypox was discovered in 1958 when two outbreaks of a pox-like disease occurred in groups of monkeys being used for research. It spread mainly through human contact with infected rodents, but can sometimes be spread through skin-to-skin contact with an infected person. There are two clades of monkeypox virus, the West African clade and the Congo Basin, Central African clade. As international travel becomes more common, viruses that were once fairly confined to certain locations can more easily spread around the world. In the summer of 2021, a case of monkeypox was found in a U.S. resident who had traveled from Nigeria to the United States. Then, 2022 brought outbreaks to regions outside of Africa, including Europe, Americas, and Australia. Now the question is, who does monkeypox affect? The answer is anyone can get monkeypox. In Africa, most cases are among children under 15 years old. Outside of Africa, the disease appears to be more common in men who have sex with men. But there are numerous cases in people who don't fall into that category. What are the signs and symptoms? After getting exposed, a person may take several days to a few weeks before they develop any symptoms. Early signs of monkeypox include flu-like symptoms. The incubation period of monkeypox is usually from 6 to 13 days but can range from 5 to 21 days. The infection can be divided into two periods. The invasion period lasts between 0 to 5 days, characterized by fever, intense headache, lymphadenopathy or swelling of the lymph nodes, back pain, myalgia or muscle aches, and intense asthenia or lack of energy. Lymphadenopathy is a distinctive feature of monkeypox compared to other diseases that may initially appear similar to chickenpox, measles, smallpox. The skin eruption usually begins within 1 to 3 days of appearance of fever. The rash tends to be more concentrated on the face and extremities rather than on the trunk. It affects the face in 95% of cases, and palms of the hands and soles of the feet in 75% of cases. Also affected are oral mucous membranes in 70% of cases, genitalia 30%, and conjunctiva 20%, as well as the cornea. The rash evolves sequentially from macules or lesions with a flat base to papules, means slightly raised firm lesions, vesicles means lesions filled with clear fluid, pustules means lesions filled with yellowish fluid, and crusts which dry up and fall off. The number of lesions varies from a few to several thousand. In severe cases, lesions can coalesce until large sections of skin slough off. Now, what about transmission? Person-to-person transmission occurs when you come in contact with the sores, scabs, respiratory droplets, or oral fluids of an infected person, usually through close, intimate situations like cuddling, kissing, or sex. Research is ongoing, but researchers aren't sure if the virus is transmitted through semen or vaginal fluids. You can also get monkeypox by coming into contact with recently contaminated materials like clothing, bedding, and other linens used by an infected person or animal. What are the diagnosis? Because monkeypox is rare, your healthcare provider may first suspect other rash illnesses, such as measles or chickenpox. But swollen lymph nodes usually distinguish monkeypox from other poxes. To diagnose monkeypox, your healthcare provider takes a tissue sample from an open sore or lesion. Then they send it to a lab for polymerase chain reaction for testing. You may also need to give a blood sample to check for the monkeypox virus or antibodies your immune system makes to it. Now, what about treatment? Monkeypox is usually a self-limited disease with symptoms lasting from 2 to 4 weeks. Most people with monkeypox get better on their own without treatment. Following diagnosis, your healthcare provider will monitor your condition and try to relieve your symptoms, prevent dehydration, and give you antibiotics to treat secondary bacterial infections if they develop. There's currently not an approved antiviral treatment for monkeypox. Antiviral drugs may help, but they haven't been studied as a treatment for monkeypox. Several investigational antivirals with activity against monkeypox are available, but only as part of a research study. How to prevent from monkeypox virus. A smallpox vaccine provides protection against monkeypox, but its use is currently limited to clinical trials. Prevention depends on decreasing human contact with infected animals and limiting person-to-person spread. The best way to help prevent spread the monkeypox virus is to avoid contact with infected animals, especially sick or dead animals. Avoid contact with bedding and other materials contaminated with the virus. Thoroughly cook all foods that contain animal meat or parts. Wash your hands frequently with soap and water. Avoid contact with people who may be infected with the virus. Practice safe sex, including the use of condoms and dental dams. Wear a mask that covers your mouth and nose when around others. Clean and disinfect frequently touched surfaces. Use personal protective equipment when caring for people infected with the virus. Now let's know some differences. Monkeypox versus chickenpox. Although they both cause skin rashes, monkeypox and chickenpox are caused by different viruses. Monkeypox is an orthopox virus, while chickenpox is a herpes virus. Both viruses can be spread through skin-to-skin or prolonged face-to-face contact, but chickenpox is very contagious and spreads more easily than monkeypox. People with monkeypox are more likely to have swollen lymph nodes than people with chickenpox. The rashes act differently too. While the chickenpox rash can appear in waves, monkeypox sores develop at the same time. Chickenpox symptoms, including the rash, tend to get better within 2 weeks, while it takes 2 to 4 weeks for monkeypox to resolve. Monkeypox versus smallpox. Smallpox and monkeypox are both part of the orthopox virus family, so they're caused by similar but distinct viruses. Thanks to effective vaccines, smallpox was eradicated, is no longer a circulating disease, by 1980. Smallpox was very contagious and spread more easily than monkeypox. Monkeypox symptoms are similar to but milder than smallpox symptoms. A note from Cleveland Clinic. The last 2 years have been incredibly challenging. The COVID-19 pandemic changed so much about the way we lived and worked. Now, just as we're starting to ease back into regular life, we're hearing a lot of media stories about monkeypox as an emerging threat. But monkeypox is a rare disease. It's spread through close contact like kissing and sex, though we're still learning about how monkeypox spreads in humans. The best way to protect yourself is to avoid contact with people who are infected, wash your hands frequently, and wear a face mask in crowded, indoor spaces. Early symptoms of monkeypox are flu-like and include fever, chills, and body aches. After a few days, a rash will begin to develop. See your healthcare provider if you develop symptoms. Thanks for watching, and please don't forget to like and subscribe my channel.